Have you ever found yourself struggling to focus, feeling restless, or getting overwhelmed by your emotions, but you're not really sure whether that's ADHD that is acting up or if it's something else like the impact of past traumas, for example? Maybe you had a tough time getting a better understanding whether your attention issues, your emotional outbursts, your sleep problems are ADHD symptoms or if they're rooted in trauma from past experiences. Or you might wonder if you can have both. Hello everyone, I'm Dr. Yanina, cognitive psychologist, ADHD coach, and ADHDer myself. Whether you've been officially diagnosed or you're currently deep diving into the internet rabbit holes, trying to figure out if ADHD might be part of your story, I've been there. ADHD and trauma can share a lot of similar symptoms, and they both can make a life feel like you're stuck in a whirlwind of emotions, distractions, and confusions. But while they might look fairly alike on the surface, their root causes are very, very different. So how do you know which one you're dealing with or if you're dealing with both? In this video, we're going to break down ADHD versus trauma, explain where the overlap happens, and give you the tools to understand what is really going on in your brain and in your body. And by the end of the video, you will have a clear picture of whether it might be ADHD, trauma, or even a combination of both that is affecting your life. So let's dive in. So what's the difference? At the core, ADHD and trauma can come from two very different sources. So ADHD is a neurodevelopmental disorder, and it's something you're born with, largely influenced by your genetics. Trauma, on the other hand, is an emotional and physiological response to distressing events, and it can come from a single incident or ongoing experiences, like, for example, childhood neglect or abuse. But despite these differences, ADHD and trauma can share a lot of overlapping symptoms, which makes a misdiagnosis a real thing and makes the diagnosis itself very, very difficult sometimes. Now, why is it so hard to tell the difference between ADHD and trauma? So studies have shown that people with ADHD are more likely to experience trauma, and individuals with trauma can also have very ADHD-like symptoms. So the symptoms can look very similar to someone with ADHD. So for example, attention difficulties, a lot of procrastination, and so on. So for example, for difficulty focusing and zoning out, that can be a symptom for someone with ADHD and also a trauma trait. But for someone with ADHD, we struggle to focus on pretty much anything and everything all the time, versus for trauma, that could be more of a shutdown response in response to a stressful event, and that can lead to dissociating due to all that stress. Versus for trauma, your brain goes into shutdown mode in response to stress, causing that brain fog and dissociation. Another overlapping symptom can be impulsivity and emotional outbursts. So for someone with ADHD, you might react quickly because your brain struggles with impulse control, versus for someone with trauma, you react strongly because your nervous system is going into fight or flight mode. Another overlapping symptom can be restlessness and hyperactivity. So for someone with ADHD, we just naturally constantly crave that stimulation and we need to move or fidget. Versus someone with trauma, your body stays in that high alert mode all the time, which makes it so hard to ever relax. Or for example, for sleep problems, someone with ADHD, you might just have trouble shutting down at night and your brain is constantly spinning and thinking about different things or coming up with new ideas. Versus for trauma, you may struggle with nightmares or anxiety or hypervigilance that keeps you awake at night. Another overlapping symptom can be difficulty regulating our emotions. So someone with ADHD, you just have a hard time regulating your emotions. They often hit you very hard and you can feel emotions very deeply. Versus for someone with trauma, these emotions may feel more overwhelming and long-lasting and are often triggered by past experiences. And these overlapping symptoms can make it really, really hard to tell whether you have ADHD, trauma, or both. So can trauma cause ADHD? The short answer, it's very complicated. So there isn't a short answer. So ADHD is mostly genetic, but research suggests that childhood trauma can make ADHD symptoms worse or even mimic ADHD symptoms in people who don't actually have ADHD. And adverse child experiences like abuse, neglect, or household instability can also impact early brain development, leading to attention and impulse control issues. So people with 2 or more ACEs are more likely to develop persistent ADHD-like symptoms in adulthood. And early trauma can also create negative memory biases, making it harder to just focus and regulate on your emotions. So while trauma doesn't cause ADHD in the traditional sense, it can make ADHD symptoms more severe or look like ADHD in people without it. So they might be showing ADHD-like symptoms. Now, can ADHD increase the risk of trauma? The connection between ADHD and trauma goes kind of both ways. So people with ADHD are also more likely to experience traumatic events because due to our impulsivity, that can lead us to accidental injuries, risky behaviors, or entering just dangerous situations. And our emotional sensitivity can make rejection and criticism feel really traumatic. And struggles with social skills can also lead us to be maybe bullied or feeling very isolated. Also, harsh parenting, so especially in families that don't truly understand ADHD, can also create an emotional wounds that feel like trauma or create trauma for someone. So if you have both ADHD and trauma, it's possible that one made the other worse over time. If you're now wondering whether it's ADHD, trauma, or a mix of both, you can ask yourself the following questions. So first, did your symptoms start in childhood? For someone with ADHD, it presents from an early age on, so before the age of 12, versus for trauma-related symptoms, they often develop after a de-stressing event. Second, are your symptoms always there or do they come and go? So for ADHD symptoms, they're consistent and don't really change based on your environment. Versus for trauma symptoms, they might flare up in response to a stressful event or certain triggers. Third, how do you react to stress? So for individuals with ADHD, we may struggle to focus even when things are calm, versus for someone with trauma, they may shut down and dissociate or feel panicked in stressful events. The next question you can ask yourself is, what's your emotional response like? So for someone with ADHD, emotions are fast moving and tend to pass very quickly. So we might be super annoyed or overwhelmed or mad at someone, and then something else happens and suddenly we're all cheery and happy again, or vice versa. And for trauma, these emotions can often feel very, very heavy, very deep, and long lasting. If you were able to relate to both, it's possible that you may have ADHD and trauma-related symptoms and that you may need treatment to address both. So if you were able to identify with both or either of them, what can you do now? So as a first and very important step is to talk to a mental health professional. So for example, a therapist, a psychiatrist, or a neurodivergent informed specialist that can help you untangle ADHD from trauma and guide you towards the right assessment and then also treatment options. The next important step is to get a thorough evaluation. ADHD and PTSD are often misdiagnosed as each other, so make sure you're being assessed by someone who truly understands both of these conditions. The next important step is to look then into different treatment options depending on your diagnosis. Treatment may include, so for example, for ADHD, medication, cognitive behavioral therapy, coaching, and lifestyle adjustments. And then for trauma, that might be trauma-focused therapy, EMDR, mindfulness, support groups. And then another very, very important step is to be kind to yourself, whether your struggles are coming from ADHD, trauma, or both of them. Your experiences are very, very valid, and healing takes time, and finding the right support can make all the difference. So now you understand that ADHD and trauma can be very deeply connected, but they're definitely not the same conditions. And ADHD is a lifelong neurodevelopmental condition versus for trauma, that is a response to distressing experiences and events. And both can lead to difficulties with focus, emotions, and just daily life, which often makes it so hard to separate these two different disorders. If you resonated with this video, don't forget to give it a like, subscribe, and hit the notification bell so you never miss an update or a new video, and that will really support me. Thank you so much. And let me know in the comments, do you relate more to ADHD, trauma, or both? Let's talk about it in the comments. Thank you all for watching, and I will see you in the next video. Bye!